Yeah, hello, wonderful people. This is Frank. This is the second part, using the care plan, part 2. But let's first look at some motivation for us. Focus. The sharper it is, the sharper you are. So today, we'll go on to the nursing care plan, part 2. Well, in nursing school, there are probably no more hated class assignments than nursing care plan. Actually, care plans provide direction for individualized care of the client. It provides continuity of care, provides care plans, teach documentation, and they serve as a guide for assigning staff to care for the client. Care plans also serve as a guide for reimbursement, but we hate nursing care plans. But if we take our time to look at care plans, we would really find that they are really fun. So how do we formulate nursing diagnosis? First of all, we have to collect data. What is wrong? Okay, our patient cannot walk. Our patient has weak limbs. Maybe our patient has difficulty sleeping. Maybe our patient has nasal congestion. Our patient may have shortness of breath. Our patients may have decreased cough efficiency. Our patient may have loss of appetite. So what is wrong with the patient? That is what we have to find out. Then we cluster the cues together. We group cues into similar categories. Let's say weak limbs, inability to walk. They are in the same area, so we put them together. Shortness of breath, different. Nasal congestion and decreased cough efficiency, they are around the same place, so you put them together. Loss of appetite, also another one. Then we identify the problem. Is it actual or potential? Now, because the patient has weakness in the limbs, the patient cannot walk, so immobility, that is an actual problem. But because of the immobility, the patient might develop pressure ulcers, risk of developing decubitus ulcers. Because the patient is coughing or has nasal congestion, there will be ineffective breathing or ineffective airway clearance. Because the patient lacks appetite, altered nutrition. So in this, you develop the problems based on whether it is actual or it is the otherwise. Now, we need to state our nursing diagnosis. First of all, so we'll use the acronym PES. The first one being the problem statement. That is the first clause that is compared with the NANDA taxonomy. So, you may have immobility, you may be high risk for or potential for impaired skin integrity, ineffective breathing pattern, ineffective airway clearance, altered nutrition, less than body requirements. So, see, based on the problems we identified, Now, the second one, etiology. Etiology is the causation. What caused it? So we are relating what the problem to the causation. So problem statement related to. So example, high risk for impaired skin integrity related to immobility. So we have defining characteristics or signs and symptoms which may or may not be included. They are preceded as evidenced by or as manifested by. So example, high risk for impaired skin integrity related to immobility as evidenced by inability to move purposefully within the environment. So, some nursing diagnoses may have a second etiology. For example, high risk for decubitus ulcers related to immobility, secondary to laparotomy. So here, the laparotomy has been added as a secondary cause of the immobility. So the decubitus ulcer is related to immobility, but the immobility is also related to the laparotomy. So high risk for the decubitus ulcers related to immobility, secondary to laparotomy. So the nursing diagnosis may have a 2 parts or a 3 parts. So nursing diagnosis is considered as a 2-part diagnosis if it comprises of only the problem statement and the etiology. The problem statement and the cause. It is a 3-part diagnosis if it is made up of the problem statement, the etiology, and the defining characteristics. So, ethical implications. So, for instance, we may write altered sensory perception related to inability to stop alcoholism. Someone may also write altered sensory perception related to alcoholism. Which is right? Which is correct? They are all altered sensory perception, but one is related to inability to stop alcoholism and one related to alcoholism. Does that make any sense? Ambiguity. Someone may say altered body comfort related to diet. Okay. But somebody may also write altered body comfort into bracket urticaria related to food allergy. Which one is right? Which one should we pick? Be thinking. And then we need to be specific. Altered sensory perception related to drug intoxication. One may also write altered sensory perception related to alcohol intoxication. And we also remember it is a legal document. Impaired skin integrity related to improper positioning. And impaired skin integrity related to immobility. So, what we need to keep in mind, we shouldn't judge. So, the correct one is altered sensory perception related to alcoholism. You don't state inability to stop alcoholism. That makes it wrong. You are judging. So you do not judge. It is altered sensory perception related to alcoholism. Full stop. Again, ambiguity. You don't say altered body comfort related to diet. Which diet? What alteration in body comfort? So this time it is urticaria. Now, what is it related to? Diet. What about the diet makes it uncomfortable? So food allergy makes it right. So you don't say related to diet. You relate it to food allergy. That makes it specific. You avoid ambiguity. Now, being specific, if you say altered sensory perception related to drug intoxication, what drug are you talking about? But altered sensory perception related to alcohol intoxication, then we know which drug you're talking about. Again, a legal document. If you say impaired skin integrity related to improper positioning, who is supposed to position the patient properly? You are caring for the patient. You are supposed to position the patient properly. You did positions in nursing in the classroom and you practiced. So when the patient comes to the ward and you don't position very well and you allow the patient to lie anyhow and the patient develops impaired skin integrity, what are you saying? So impaired skin integrity related to immobility, that is right. You don't impair skin integrity related to improper positioning. You are in trouble, because the time we see you write that, you are going to court. So thank you. We'll be back with another video the next time. Thank you.